When patient satisfaction declines, the instinct is often to react, add more staff, increase oversight, and push harder. But what if the real issue isn't effort, it's the system? Across multiple acute care hospitals, teams were working hard. Yet patient satisfaction scores weren't improving. What followed wasn't a quick fix. It was a fundamental shift in how performance was understood, managed, and sustained. TouchPoint activated its performance excellence model, re-engineering operations, translating data into frontline action, and building a system designed to improve over time. The result saw sustained gains in cleanliness scores, stronger associate engagement, and a more resilient operational framework that continuously enhances patient experience. TouchPoint support services uncovered a critical disconnect. While 70 to 90% of patient feedback originated in emergency departments, inspections, leadership rounding, and operational focus remained concentrated in inpatient areas. At the same time, internal quality assurance scores painted an overly positive picture. Paper-based workflows slowed frontline teams and limited efficiency. Leaders lacked a shared real-time view of performance to intervene early. The result? A system that appeared functional on the surface, but failed to reflect the true patient experience. This wasn't a performance problem. It was a system design problem. Instead of applying short-term fixes or adding labor, TouchPoint took a different approach. They activated their performance excellence model, re-engineering operations to translate data into action, and building a system designed not just to improve performance, but to improve it continuously over time. The model was grounded in 3 core principles. Focus operations where patients actually experience care, flex operations using real-time data, build disciplined, continuous improvement loops. This wasn't about reporting data. It was about operationalizing it. By combining advanced analytics with on-site operational expertise, teams were able to pinpoint exactly where patient dissatisfaction originated, down to specific departments, units, and spaces. They introduced realigned inspections and leadership rounding in high-impact patient-facing areas, QR codes in restrooms and waiting rooms to capture real-time feedback, site-specific action plans following every visit, bi-weekly accountability sessions with leadership. For the first time, everyone, from frontline associates to executives, was working from a single, integrated, real-time view of performance. This unified system connected patient feedback, QA results, task execution, financial performance, and even AI-generated action plans, creating an operating model built for action, not just analysis. Technology played a critical role, but only because it was designed around the people using it. The system adapted dynamically to real conditions. Tasks were prioritized based on patient impact. Workloads became realistic and achievable. Alerts flagged issues before they escalated. Frontline teams no longer worked in the dark. They completed each shift knowing their work was both achievable and meaningful. Managers gained visibility, leaders gained clarity, and teams gained confidence. At the same time, paper-based workflows were replaced with streamlined digital tools, improving efficiency and enabling faster response times where it mattered most. The impact was both rapid and sustained. Across 5 hospitals, cleanliness scores increased by 10.9 points year over year. QR code-generated service requests rose 59% month over month. Quality assurance activity increased by 59% in high-impact areas. high correlation QA surveys tied to patient experience increased by 81%. At one hospital, cleanliness scores improved from -4.2 to 32.4 in just 2 months after inspections, rounding, and task prioritization were realigned. Even more importantly, these gains continued to compound, including through historically challenging winter months, when performance typically declines. This wasn't a temporary improvement, it was a system that kept getting better. Performance excellence works because it aligns everything that drives outcomes: real-time analytics, adaptive technology, leadership behaviors, and frontline workflows into a single operating system. Associates finish their shifts knowing their work is impactful. Leaders coach with data instead of guesswork. And hospitals move from reactive problem-solving to proactive performance management. The takeaway is simple but powerful. Sustainable performance doesn't come from working harder, it comes from designing smarter systems. By aligning data, technology, leadership, and frontline execution, TouchPoint transformed not only how hospitals operate, but how patients experience care. Because continuous improvement isn't an initiative, it's an operating system. Discover how performance excellence can transform your operations at touchpointsupportservices.com.